All right, we're going to move on to the TIB fib, and we're going to do our instructional video. So I'm going to be the technologist, and Mrs. Skaggs is going to be the patient, and we're going to run through the two views, the AP and the lateral. So we'll start with getting our patient all nice and shielded. Again, since we're doing the lower extremity, we can use a full shield. And then I'll have my patient take off their shoe and sock. If they have on pants that are like really skinny jeans or some thick pants like Carhartts, you might have to have them changed totally because those will show up. But we can just have Mrs. Skaggs roll her pant leg up, and that makes it easy for us. So for these, we're going to be using a 14 by 17 cassette, and our red line is going to be towards the knee, because that's how we want it to load. So I'm just going to have her go ahead and lie on back for this, and I'm going to slide my cassette right underneath of her leg. Now, as you can see, when I'm moving this up so that I can make sure I'm getting her knee, I'm not getting her ankle. So I am going to turn and put my cassette right at a diagonal to make sure that I get both joints on one. You may have a patient, especially men, who are taller, do not fit all on one, even when you turn it at this diagonal. And in that case, you'll have to do two separate images, an upper and a lower. So luckily, our patient fits on one. So we will just put this at an angle, and we'll be using 40 SID. I'm just gonna go here to midway on her leg, and then I'm just gonna open my collimation to include her ankle and her knee both. When I center on her leg, I'm just centering between the two sides of her leg. I'm just going right to the middle, and that's what you're looking for, you're centering. I'm collimating down, and I'm going to mark the lateral aspect. Now, to get her leg in really good position, I'm going to have her pull her toes back towards her, flattening her foot, or what we call dorsiflexing the foot. And I'm going to check to make sure her femoral condyles are parallel to my IR. So that means I don't want her leg turned in like this or out like that. I'm going to make sure that it's nice and straight and her foot is pulled back towards her very well. And that looks good. Since we're not using a grid, we're going to use 70 kVp, but if I were using a grid, I would increase that kVp to 80, and then we would expose here. One more thing I'd like to point out is that when you have someone in this full apron, when they roll or when they sit down, it might be like this. So just make sure that when you're looking at your patient overall before you expose, that you have the lead out of the way, because otherwise you won't get to see anything where that lead is. That's what lead does, it blocks x-rays. So once we got our AP done, we will do the lateral. I'm going to kind of move this out of your way. So it depends on your patient condition as to how they can position themselves into a lateral. Some patients, like Mrs. Skaggs, you can tell them to just roll their knee out, and they can easily roll their leg all the way out. Some people can't do that. Some people need a little bit of help. Something that might help your patient is if you ask them to bring this non-affected leg, the shoe that is still on, bring this leg all the way out in the front, cross it over, and therefore putting their whole entire body rolled forward, and that way it'll position their leg flat down onto the table. So we're just going to make Mrs. Skaggs do this so we can see what it looks like. And then I'm going to slide my cassette under. Once again, I'll have to do it at a diagonal to get everything on here. I'm just going to the center of her leg in both directions. Make sure my collimation is open enough that I get all my soft tissue on the back and the flat portion on the front. Once I get marker on. I'm gonna again have her dorsiflex her foot, pull that back so that way we get a nice, very straight. Now, what I'm seeing now is that I think her knee is a little bit too high and I really need it turned down. So I'm still gonna kind of have her rolling. If you have to, you can use a sponge. And you can put this right underneath their ankle to keep their legs straight. What you're looking at to make sure they're straight is you're looking right across their shin here to see that they've got a straight line. It's parallel to the IR. If it's not, then you need to either support their knee or ankle to get them to that position. Again, for this one, we will use the same technique. We will be using a 70 kVp because we're not using a grid. If we were using a grid, we would bump that up to 80. And those are our two tip fib projections.